12 ways to boost testosterone production naturally in men. If you feel tired, stressed, unfocused, struggling to achieve your goals, or disconnected from your partner, it's not because you're weak. It might be your testosterone begging for help. And the good news? You can fix it naturally, starting today. Hi, I am Dr. Jean-Pierre Kabongo, health advocate, family physician, and founder of the movement HOMESTEADication. Today, we will explore the most effective natural ways to support and increase testosterone production, from the most powerful actions to the least, following the principles of the HOMESTEADication movement, which believes that health begins at home, long before medications. Testosterone is one of the most important hormones in the human body. It is produced mainly in the testes for men and in smaller amounts in the ovaries and adrenal glands for women. Testosterone influences muscle mass, bone strength, energy levels, libido, motivation, mood, and even metabolic health. When testosterone becomes low, many people begin to experience fatigue, reduced strength, poor sleep, emotional instability, depression, reduced libido, declining vitality, weak bones, and even anemia. Many people think testosterone is only about sexual function, but its role goes far beyond that. In men especially, healthy testosterone levels support motivation, drive, confidence, and resilience, both physical and mental. These qualities influence how we handle challenges, how we pursue goals, and even how we show up in our families and communities. In other words, testosterone isn't just a sex hormone. It's a foundational hormone for overall well-being and for stepping fully into one's life purpose and potential. Without further delay, let's start the 12 evidence-based ways to naturally boost testosterone in men. 1. The first and most powerful strategy is resistance training and high-intensity interval training. Lifting weights, especially compound movements like squats, deadlifts, and presses, has repeatedly been shown to trigger a strong testosterone response. A number of studies confirm that resistance training increases testosterone levels, while high-intensity intervals can boost the hormone even further. Moving your body the way it was designed to move is a core HOMESTEADication value: natural, functional strength built at home or in any simple environment. 2. The second most important factor is nutrition. Testosterone requires cholesterol, protein, zinc, magnesium, and healthy fats for optimal production. Diets that are extremely low in fat have been shown to reduce testosterone. A meta-analysis published in 2022 confirmed that low-fat diets significantly reduce both total and free testosterone compared to balanced diets. Foods such as eggs, especially its yolk, fatty fish such as salmon and sardines, and other fatty food like avocados, olive oil, nuts, pumpkin seeds support testosterone production. Shellfish like oysters provide zinc, one of the raw materials the body needs to produce hormones naturally. Finally, cruciferous vegetables are necessary, especially in the conversion of testosterone into estrogen. In the HOMESTEADication philosophy, food is the first medicine, and every meal can be a chance to nourish your hormones. 3. The third essential pillar is vitamin D. This nutrient acts more like a hormone than a vitamin and plays a major role in testosterone regulation. Research consistently shows that low vitamin D levels are associated with low testosterone, and supplementation can improve testosterone levels in people who are deficient. Sunlight is the most natural source of vitamin D, but in northern countries, supplementation with 2,000 international units per day may be necessary. Again, HOMESTEADication emphasizes reconnecting with nature, sunlight as daily medicine. 4. Optimize zinc and magnesium. Zinc supports the cells responsible for producing testosterone, and magnesium helps increase free testosterone, especially in people who are deficient. Foods rich in these minerals include oysters, legumes, leafy greens, and nuts. These minerals are often depleted in modern diets, making simple home-based nutrition a powerful tool. If there is deficiency, the recommended daily dosage is 25-40 milligrams elemental zinc per day, usually for 6-12 weeks. However, for magnesium deficiency, 200-400 milligrams elemental magnesium glycinate, citrate, or malate per day at bedtime is recommended. The dosage can be adjusted in case of loose stool. The fifth pillar is sleep. Testosterone is produced mainly at night. Studies show that even 1 week of sleeping only 5 hours per night can drop testosterone by 10 to 15%. Deep restorative sleep is one of the strongest natural hormone boosters we have. Let me share a real case that perfectly illustrates the above. One of my patients, let's call him Paul, came in with weakness and trouble being intimate with his wife. His blood tests showed extremely low testosterone, the levels of a much older man. No medications, no obvious cause. So he was sent to a urologist, and the urologist discovered the truth. Paul was working 3 jobs, barely sleeping 3-4 hours a night, trying to save for a down payment of the family home. He was told, sleep 8-9 hours for 1 week, then retest. And guess what? His testosterone came back completely normal, no drugs, just sleep. This is pure homesteadication, simple, accessible, and foundational health that begins at home. Managing stress is critical. Chronic stress elevates cortisol, and cortisol directly suppresses testosterone. Techniques like slow breathing, prayer, meditation, mindfulness, walking in nature, or simply resting the mind help lower cortisol and restore hormonal balance. A 42-year-old patient of mine, let's call him Martin, came asking for medication to improve his intimacy. He said things at home weren't working anymore. As we talked, the real issue came out: constant conflicts with his wife, daily arguments, no peace at home. Chronic stress like that can crush testosterone. I sent him and his wife for marriage counseling. And guess what? The relationship improved and his intimacy returned before he even did his blood test. If so far you find this content helpful, please subscribe to MediLink Talks so you don't miss a similar research-based video like this. Another important strategy is reducing exposure to endocrine disruptors. Chemicals like PFAS, BPA, and phthalates found in plastics and some personal care products. These chemicals mimic estrogen and can interfere with testosterone production. Reducing plastic use, improving ventilation, and choosing natural household products are simple steps that protect hormonal health. Maintaining a healthy body composition is also important. Excess abdominal fat increases aromatase activity, an enzyme that converts testosterone into estrogen. Losing excess fat naturally increases testosterone. This is another area where lifestyle becomes more powerful than medication. Quitting alcohol is also beneficial. Heavy or frequent alcohol consumption interferes with testicular function and suppresses testosterone. Moderation supports better hormonal balance. Review the medication list. Several commonly prescribed drugs can suppress testosterone production or interfere with androgen activity. Here are some of the most important categories. Opioid pain medications such as morphine, oxycodone, hydromorphone, fentanyl. Chronic opioid use suppresses the hypothalamic pituitary gonadal axis and testosterone production. Glucocorticoids, steroids like prednisone, dexamethasone on long-term use increases cortisol levels, which directly inhibits gonadal function and lowers testosterone. SSRIs and other antidepressants like sertraline, fluoxetine, paroxetine can reduce testosterone and are clinically associated with reduced libido and erectile issues. Antihypertensives like beta blockers, metoprolol, propranolol, thiazide diuretics, hydrochlorothiazide can contribute to erectile dysfunction and indirectly lower testosterone activity. Statins like atorvastatin, simvastatin reduce cholesterol availability, which is the precursor for testosterone synthesis. Antiandrogens, prostate medications like finasteride, dutasteride, spironolactone. These directly block testosterone conversion or inhibit androgen receptor activity. Antifungal medications like ketoconazole can lead to dramatic drops in testosterone. Chemotherapy agents like cyclophosphamide, cisplatin can have cytotoxic effects and damage Leydig cells and suppress testicular function. Antipsychotics such as risperidone, haloperidol increase prolactin levels, which suppress gonadotropins and decrease testosterone. H2 blockers like cimetidine that is used to treat heartburn reduces testosterone binding and interferes with androgen receptor activity. You will then understand that by practicing pre-primary healthcare principles that we advocate in our HOMESTEADication movement, you are likely to minimize the above medication side effects. Certain natural supplements can help, especially when deficiencies are present. Ashwagandha has been shown in some studies to increase testosterone by reducing cortisol and improving vitality. Fenugreek has demonstrated modest improvements in testosterone in some trials. Zinc and magnesium supplementation may help if low levels are documented. These supplements are optional. Lifestyle foundations are far more effective and sustainable. Finally, sexual activity does influence testosterone in various ways. Researchers have shown that sexual arousal increases testosterone temporarily. During sexual arousal, visual, physical, or emotional, the brain activates the hypothalamus, which leads to a short-term surge of testosterone. Regular sexual activity supports stable testosterone levels. Men who are sexually active more often tend to have higher baseline testosterone than those who are abstinent. Sexual satisfaction lowers cortisol, indirectly supports testosterone. Healthy intimacy reduces stress hormones, cortisol, and since cortisol inhibits testosterone, good relationship can indirectly improve hormonal stability. In summary, the prevalence of low testosterone throughout the world varies from one region to the other. Clinical studies estimate this at 5–25% depending on criteria. Testosterone is central to vitality, strength, energy, well-being, and it is key to achieving one's life purpose. Therefore, it is not only a sex hormone. The most effective natural ways to support healthy testosterone levels are simple, accessible, and rooted in the HOMESTEADication philosophy. Move your body, nourish yourself with whole foods, get sunlight, optimize sleep, reduce stress, stay socially and emotionally connected, avoid toxic exposures, and build your health from home outward. Supporting your body naturally not only boosts testosterone, it strengthens your entire foundation of health for years to come. Please comment and share this video with your friends and family.